can you share what maybe works best in closing these healthcare experience gaps? And then what do you feel are the best practices in creating a better patient engagement strategy?
So what I've seen, that's a very good question. So, I Red Point Global got involved in healthcare 7 years ago. Okay, so we've seen a lot. To be quite frank, we've seen a lot. We have a lot of healthcare clients. We have a solution that's very secure around the data, right? And so if you want to know all that's knowable about someone's health, you need all the data on their health. If you want to know all that's knowable on a consumer, you need all the data on the consumer. So from that standpoint, I've seen companies that do really good job of knowing all that's knowable gaps that just need to be filled over a period of time. Okay. And so we have clients that start with nothing. They have nothing. They literally have nothing. They have no database and they have no way to engage if they did. So I've seen that. I also see, which I think you want me to talk about, customers who've gone down the journey. They've been on it for 2, 3, 4 years, always thinking about the customer-centric approach and everything they build. And so in that scenario, what I can tell you is there's a lot of hope, okay? Because right now we have a customer that is what I say in generation two. They've married the payer with the provider, right? So now all of the ways that you pay for the care that needs to be there is together with where you're going to getting care. So
Mhm.
what essentially that relationship there where the payer and provider come together, that's created a is incentivized to take care of the patient's health. So that's what value-based care is. I'm not going to pay you fee for service, $1 for $1. I'm going to pay you for improving Chris and Brianna's health. And that's a special arrangement. It's called value-based care. So what the provider does then, naturally they say, wow, I've got to get doctors and all my processes around getting patients to always want to be with me, right? And so right there, just the business model, just taking down the silos, just having the same goals around business goals around that is changing the experience for the patient. And I'll tell you why. So what happens is, let's say the ACA market, ACA market, right? Individualized plan. Well, the individualized plan is for people who are either not working in a commercial plan, or they have a small business, or they are, low income and they need to be able to get assistance to purchase insurance. Well, they also typically are the most unhealthy because they've never had insurance. They couldn't afford to go see the doctor. So instead of going into a bad healthcare experience and the first time they're going in to see a doctor, guess where they're being sent? They're being sent to the brand new way, the new doctors that are only focused on their health. And so their first experience right out of the gate with healthcare is positive. Now, here's the other thing. Some of these people speak English, some speak Spanish, right? So there's doctors who speak English and they speak Spanish. And some people who speak Spanish, I live in South Florida, they also speak English. They prefer to be spoken to Spanish in one way with certain groups, and they prefer to speak English with other groups. How do you know that? Well, we know that because we have consumer data. They tell us. They interact with us different ways. So this new healthcare company that I'm talking about, they send out language and videos and anything that the patient's language and the way the patient wants to see it. So that's how it starts. And now all of a sudden you build trust with the patient. You build trust with the consumer. And what happens when you build trust with someone? They give you more information, more data about them, right? And so now it's a full circle. It all works together. Everyone's working together. So that's what I'm seeing work, in the industry.